Hey there, and welcome back to our channel. In today's video, we're going to talk about something incredibly important: the early signs of heart failure that you should never ignore. Heart failure is a serious condition that affects millions of people worldwide, and recognizing the early warning signs can make a huge difference in getting the right treatment and improving your quality of life. So, make sure to watch until the end, as we're going to cover 9 crucial symptoms that you need to be aware of. If you find this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to our channel for more health and wellness tips. Let's dive right in. Recognizing the early signs of heart failure is essential for timely intervention and effective management of the condition. Heart failure occurs when the heart is unable to pump blood efficiently, leading to a buildup of fluid in the lungs, legs, and other tissues. Early detection and treatment can help prevent the progression of the disease and improve outcomes. Here are 9 early signs of heart failure that you should never ignore. Fatigue and weakness. One of the earliest and most common signs of heart failure is persistent fatigue and weakness. When the heart is not pumping blood effectively, your muscles and tissues do not receive enough oxygen and nutrients. This can leave you feeling unusually tired and weak, even after minimal physical activity. If you find yourself struggling with fatigue that doesn't go away with rest, it's important to talk to your healthcare provider. Shortness of breath. Shortness of breath, especially during physical activity or while lying down, is another key indicator of heart failure. When the heart's pumping ability decreases, fluid can accumulate in the lungs, making it difficult to breathe. You might notice that you are short of breath after climbing a flight of stairs or even when lying flat on your back. This symptom is known as orthopnea and can be relieved by propping yourself up with pillows while sleeping. Persistent cough or wheezing. A persistent cough or wheezing can also be a sign of heart failure. This occurs because fluid can build up in the lungs, leading to congestion and respiratory issues. If you have a cough that doesn't seem to go away, especially if it produces white or pink-tinged mucus, it's important to seek medical attention. These symptoms can indicate that fluid is backing up in the lungs due to heart failure. Swelling in the legs, ankles, and feet. Edema, or swelling in the legs, ankles, and feet, is a common sign of heart failure. This happens because the heart is unable to pump blood effectively, causing fluid to accumulate in the lower extremities. You may notice that your shoes feel tighter or that there is noticeable swelling in your legs and feet. Pressing on the swollen area may leave an indentation, known as pitting edema. Rapid or irregular heartbeat. An irregular or rapid heartbeat, also known as arrhythmia, can be a sign that your heart is struggling to pump blood effectively. You might feel palpitations or an unusual sensation in your chest, such as fluttering or pounding. Arrhythmias can occur because the heart is trying to compensate for its reduced pumping ability. If you experience these symptoms, it's important to seek medical evaluation. Increased need to urinate at night. Frequent urination at night, also known as nocturia, can be an early sign of heart failure. When you lie down, fluid that has accumulated in your lower extremities can be reabsorbed into the bloodstream and processed by the kidneys, leading to an increased need to urinate. If you find yourself waking up multiple times at night to use the bathroom, it's worth discussing with your healthcare provider. Difficulty concentrating or confusion. Reduced blood flow to the brain can cause cognitive issues such as difficulty concentrating or confusion. You might find it hard to focus on tasks, experience memory problems, or feel unusually disoriented. These symptoms can be subtle but should not be ignored, as they can indicate that your brain is not receiving enough oxygen-rich blood due to heart failure. Loss of appetite and nausea. Digestive issues, such as loss of appetite, nausea, and a feeling of fullness after eating small amounts, can also be signs of heart failure. This occurs because the digestive system receives less blood flow, leading to issues with digestion. If you notice a significant change in your appetite or experience ongoing nausea, it's important to seek medical advice. Chest pain. While chest pain can be a symptom of many different conditions, it can also be a sign of heart failure. This pain can be caused by reduced blood flow to the heart muscle itself or by fluid buildup in the lungs. Chest pain related to heart failure may feel like a heavy or tight sensation in the chest and may be accompanied by other symptoms such as shortness of breath or fatigue. If you experience chest pain, it's crucial to seek immediate medical attention. Understanding and recognizing these early signs of heart failure can make a significant difference in managing the condition. Early intervention can slow the progression of heart failure, improve quality of life, and reduce the risk of complications. Here are some additional tips for managing heart failure and maintaining heart health. Follow a heart-healthy diet. Eating a balanced diet that is low in sodium and saturated fats can help manage heart failure symptoms and improve overall heart health. Focus on consuming plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Limiting salt intake can help reduce fluid retention and swelling. Stay physically active. Regular physical activity can strengthen the heart and improve circulation. Aim for at least 30 minutes of moderate intensity exercise, such as walking, swimming, or cycling, most days of the week. Be sure to talk to your healthcare provider before starting any new exercise program. Monitor your weight. Keeping track of your weight on a daily basis can help you detect fluid retention early. Sudden weight gain can be a sign of worsening heart failure. If you notice a significant increase in your weight, contact your healthcare provider. Take medications as prescribed. If you have been diagnosed with heart failure, it's important to take your medications as prescribed by your healthcare provider. Medications can help manage symptoms, improve heart function, and reduce the risk of complications. Stop alcohol and limit caffeine. Alcohol and caffeine can exacerbate heart failure symptoms and lead to dehydration. Limit your intake of these substances to help manage your condition. Manage stress. Chronic stress can worsen heart failure symptoms. Practice stress management techniques such as deep breathing exercises, meditation, and yoga to help reduce stress levels and improve overall well-being. Avoid smoking. Smoking can damage the heart and blood vessels, worsening heart failure symptoms. If you smoke, seek help to quit as soon as possible. There are many resources available to support smoking cessation. Regular medical checkups. Regular visits to your healthcare provider are essential for monitoring your heart health and managing heart failure. Follow your healthcare provider's recommendations and keep all scheduled appointments. Educate yourself. Understanding heart failure and its symptoms can empower you to take control of your health. Stay informed about your condition and ask your healthcare provider any questions you may have. Support system. Having a strong support system can make a significant difference in managing heart failure. Lean on friends, family, and support groups for emotional and practical support. In conclusion, recognizing the early signs of heart failure is crucial for timely intervention and effective management. Fatigue, shortness of breath, persistent cough, swelling, rapid heartbeat, frequent urination at night, difficulty concentrating, loss of appetite, and chest pain are all warning signs that should not be ignored. By making lifestyle changes, following a heart-healthy diet, staying physically active, and taking medications as prescribed, you can manage heart failure symptoms and improve your quality of life. If you experience any of these symptoms, it's important to seek medical advice promptly. Thank you so much for watching. We hope you found this video helpful in understanding the early signs of heart failure and how to manage this condition. If you learned something new today, please give this video a thumbs up, share it with your friends and family, and subscribe to our channel for more health and wellness tips. Don't forget to hit the notification bell so you never miss an update. Stay healthy, and we'll see you in the next video.